My name is Sarah Money, and I work at Southern Colorado Health Network here in Pueblo. We do a lot of different things, but one of our big programs is Access Point Pueblo, which is a syringe access program. We train people on Naloxone administration every day, and so we thought it would be really cool to partner with the health department and get a training out there for community members, because opioid use disorder truly impacts everyone. So today, I'm going to be going over how to administer naloxone. Naloxone, or Narcan, is the brand name for naloxone. Just means that it's in the nasal atomizer. Looks just like this. So I'm going to go over how to administer the nasal form and the injectable form. I'll be using the term naloxone to refer to both, but if I'm talking specifically about the nasal atomizer, I'll try to say Narcan. Hopefully it won't get too confusing. So naloxone is an opioid antagonist, which means that it can undo the effects of an opioid overdose. It works by binding to the opioid receptors in your brain, so it can block the receptors from binding with opioids as well as reversing the effect of opioids that are already in your system. Narcan and naloxone can be used to reverse an overdose caused by pills like hydrocodone, Percocet, Vicodin, Oxycontin, and as well as street drugs such as heroin and fentanyl. It's a really good idea for anybody with a prescription to carry naloxone or Narcan on them and to train the people around them how to use it. People who are buying pills and illicit substances should also carry naloxone or Narcan on them. It's worth noting that there's fentanyl in a lot of places around the country, and we've seen an uptick here in Pueblo. Fentanyl is a common cutting agent, and it acts like an opioid. So Narcan and naloxone can actually be used to reverse a fentanyl overdose. Just a little thing that y'all should know too. We actually have fentanyl test strips here on hand. And fentanyl test strips are a really effective way to test your substances before you're using them. You definitely want to test anything that you've purchased that you haven't gotten from a pharmacy. So let's get started with the training itself. Naloxone can be a little scary, but it's super easy to administer. So first, I'm going to talk about Narcan in the nasal atomizer. You can pick up Narcan from most pharmacies. In Colorado, pharmacists are allowed to both write and fill a Narcan prescription. I know this for a fact because I got this from a pharmacy here in town yesterday. It's super easy to use. So if you think someone is having an opioid overdose, first you want to look for the signs. So if a person is nodding off or starting to pass out, if they're stopping or slowing their breathing, if their lips and fingertips are turning blue, and you're seeing kind of slowed heart rate, the first thing that you want to do, shake, shout, sternum rub. So shake the person, shout at them. Do a sternum rub. So make your hand like a fist, rub their sternum. Don't be nice about it. The goal is to wake them up. If a person is still unresponsive at that point, go ahead and make that 911 call. So stay with the person, make the 911 call, administer Narcan. You are protected by law if you administer Narcan and you stay with the person. So now for Narcan administration. So Narcan in the nasal atomizer is more common than the injectable form. So this is probably what you'll have on you if you decide to carry Narcan or naloxone on you. First, you're going to remove it from the blister pack, and you're going to put your first finger and your middle finger on the top, so right here, and then put your thumb on the red trigger. Place this up someone's nose and push the trigger. If a person isn't breathing, you want to try and breathe a little bit up their nose. Narcan doesn't require complete inhalation, but it has to absorb into the mucous membranes of the nasal cavity. So if a person isn't breathing, it might not get all the way up there. Make sure you breathe up into their nose to get it up there. One atomizer is one dose. Now to go over the injectable form, which some people have on hand and some people believe it's more effective, especially when there's fentanyl involved. So what you'll do if you have the injectable form, you should have a vial and an intermuscular syringe. You'll pop the orange top off the vial, flip it upside down, insert the tip of the syringe, and draw up the entire contents into the syringe. One vial is equal to one dose. Then you're going to find a large muscle on the person who's having the overdose. Look for their thigh muscle, their butt muscle, or their arm muscle. You're going to insert the syringe straight in, 90-degree angle, and insert or push all of the naloxone into the person. Now, if a person, so after you've administered the Narcan or naloxone, you want to flip the person onto their side so that they're in recovery position. You keep their airway clear that way, and just in case of vomiting, you want to make sure that they're going to get it out and they're not going to choke. You want to make sure the person's going to wake up. So flip them into recovery position. If a person doesn't respond after 2 to 3 minutes, be ready to give a second dose of naloxone. Again, 2 or 3 minutes after that, be ready to give a third dose. It can take 4 to 5 doses, especially when there's fentanyl involved. Typically, if it's pills, it'll only take 1 or 2, but that could depend on the person, what their tolerance is, and how much they've actually consumed. If a person has not started breathing while you're waiting on that 911 call, rescue breathing. So cover the person's nose, tilt their head up a little bit and breathe in. You want to see their chest rise because you're breathing for them. You want to make sure that they're getting oxygen to their brain while they're out like that. So, like I said, if a person hasn't woken up after 2 to 3 minutes, be ready to give a second dose. Some other things to keep in mind, that's kind of all the general training, but some other things to keep in mind about naloxone. It is temperature sensitive. So the temperature range that they advise you keep it is between 68 and 75 degrees. Don't store Narcan or naloxone in the glove box of your car. I don't need to tell you why. It gets hot here. Now, if naloxone or Narcan has gotten out of that temperature range for a brief period of time, it's still going to be effective. You just want to make sure it's not kept at a higher or lower temperature for a significant amount of time. So, if it is outside that temperature range or it's expired, because naloxone and Narcan kind of have a short shelf life, still go ahead and administer it. Expired naloxone is better than no naloxone. Naloxone that's been too hot is better than no naloxone. You are protected by law if you administer expired naloxone. It's been shown to lose its efficacy pretty slowly. So if it's 1 or 2 years past the expiration date, it's probably still going to be just the same. So just keep it in mind, if it is super expired, get some new naloxone or Narcan, but if that's all you have on hand, go ahead and administer. Now, while I have you guys, I want to go over some common misconceptions. So some people believe that Narcan can encourage people to overdose, and that's simply not true. Most people are not trying to push themselves to the brink of death. Another common myth is that naloxone can be abused. That's also not true. There's no abuse potential for naloxone. And unless opioids are actually in someone's system, naloxone won't do anything. There's no risk administering it to somebody who doesn't have opioids in their system. So if you believe in good faith that there might be opioids involved, go ahead and administer. The last misconception I want to go over, and it's fairly common, is that people will come out of an overdose and be aggressive. Now, this has happened a handful of times, and most of those have been in medical settings where the administration looks different. So the fear of someone being aggressive should not stop you from trying to save their life. That's pretty much it from me. But if you ever want to talk more, stop by our office. We love to talk about this. We love to talk about naloxone. We love to talk about fentanyl test strips. We will talk to you about anything. We are located at 807 North Greenwood. So we're on the corner of 8th and Greenwood. We run syringe access on Tuesdays and Thursdays, but we're here to help any day of the week. We can provide you with fentanyl test strips. We can provide you with naloxone. We can also help direct you where to find Narcan if you prefer the nasal atomizer. We can help you explore treatment options, or we can just chat about you or your loved one's use. So the health department, in conjunction with this, is going to be sharing a list of resources if you don't feel comfortable coming and talking to people. But, putting this video out there is another way that we can keep each other safe. So let's just work hard to keep our community safe.